has many voices. Before the experts debate them, before the politicians defend them, we hear it directly from the people. Hello and welcome to Citizens Direct on TVWest. I am Victoria Ogudende, and today we hit the streets to ask citizens about that one thing that they will change about government hospitals in Nigeria. Let's go. Access to quality healthcare remains a major concern for many Nigerians, with challenges ranging from affordability to availability of medical services. Today on Citizens Direct, I'm hitting the street to ask citizens about that one thing that they will change about government hospitals in Nigeria. Let's go.
What I see that can improve Nigeria government hospital? I mean, the whole 30 states of Nigeria, they should try and increase our facilities. We are lacking facilities. They try, they're not like government, doctors and nurses are going on strikes. They are sad, they try and pay them on time because they have family to feed on. They try and bring down the level of the lab fee, the drugs fee. If they can even provide free drugs, because so that people can even afford. These are not equal. So I came from a wretched background that they need to attend to. They need medical attendance. I pray God will help our government. It's not easy. We are praying for them. May God help them.
Well, to the best of my knowledge, from what I know, like I said, everything about government healthcare in Nigeria is in shambles. Because when you go to the hospital, first of all, doctors and nurses are not well taken care of. They are not well paid. Their allowance, in fact, everything, they are not well taken care of. Then secondly, there are no drugs in the hospital. You go to the hospital, they will refer you to a private laboratory for tests. They will refer you to a private pharmacy for you to get your drugs. So, okay, thank you. So to that extent, everything, I would like to change everything about government healthcare in Nigeria.
So I think one of the most fundamental aspects of the nation is the health sector of Nigeria, because that's where our lives are saved. The very importance of the doctors, the nurses. So I think one of the most important problems are the infrastructure. So if I'm in the position of the government, I think one of the most important aspects I work on are the infrastructure. Health facilities. Because that's where things are provided to support the needs of the people, the injured, because all lives cannot be vulnerable. The government needs to protect the very needs and the health of the citizen, which is the most important aspect of life, the health security of the...
One thing I will change about government hospitals in Nigeria is I will ensure that government hospitals are properly funded and equipped so patients can get their quality health care.
The only way to approach the issue is to put this in order. One, from one perspective, one is for them to make everything easy for the masses. Because if, for example, like I went to this general hospital, I stand on the queue less than 3 hours for me to get a drug to my mom. Okay, if I way that they quickly equip where I can easily get somewhere inside the hospital and get it very easily and very small money for affordable. But everything is very expensive.
I would say the infrastructure, the equipment, and the salary. So what they need to do is work on their infrastructure, because I think they lack many infrastructures, one, and they lack many instruments for it. And I think if they pay their workers well, everybody will, because I think in Nigeria now, the pay moves people to do their work perfectly well. Because you can't come to work and they're paying you almost less than what you should get, and you're attending to somebody, you get frustrated when you are kind of working. So I think they should increase the pay, infrastructure, and the equipment.
Government hospital is all about the workers' attitude. The first thing I will change if I have the power with me is the workers' attitude. Because health staffs, health workers are supposed to be humanitarian, but most of them are definitely not. I'm not trying to point a few accusing fingers of them. It is in our blood, especially being Nigerians. We don't have that spirit of care towards one another. So the first thing I will change is the attitude of workers, health workers, by introducing training programs that can sanitize, that make them become more of humanitarians than just health workers, ordinary health workers, because many of them are working just for the salary. But they're supposed to remember first that they are humanitarians before the salary aspect come into it. Then government have to think about increasing the health workers' remuneration, because that added incentive will go a long way to ginger them to work more, give more of that humanitarian aspect of them towards the patients.
The government workers should have a fear of God, in the sense that the way they interact with their what's it called? Is it the clients or the patients? Yes. So they should have a fear of God and how to interact with them. Most of them they are evil. They don't have a fear of God. Like one day, for instance, one day I went to this general hospital. I go there I have a stomach running. I have a stomach pain. So I went down there. I explained my situation to them. So they said because they did not carry me come, or I did not took a motor or vehicle come, that I'm not emergency, that I should go and set back. I said, I'm having stomach pain, that they should attend to me. They said no, they will not attend to me. So ever since then, I've not entered there. So may God help us.
First of all, we have to be practical here. We have 24 or 20 local governments in Lagos State, and each local government is being one general hospital man the entire local government. Let us be practical. Can, God forbid, let's assume there's an emergency, can that local government manage 20 streets? Let's assume there's a casualty that affected the entire 20 streets in a local government, which I believe is less than 10% of the entire street in that local government. So the issue here is this: we are not being practical. What we have is not sufficient to the number of people they ought to have attended to. If you look at the total number of the doctors here, they are not up to. Let's say the total surgeon here, they are not up to 100. Because I'm not in medical line, we have surgeon, we have opticians. If you look at each and every one of them, they are not up to 100 in numbers, and they have thousands of persons to attend to. They're also human beings like us. But the issue here is there's no transparency between the citizen and the government. Thank you. The word transparency is very clear. I want to see what is going on there. What is their budget? Now, what the government needs to do for us in quote now is the total population of people staying in Ikeja is 10 million. The total population of people staying in Ikeja are 500,000. Yeah. The total number of surgeons we have in Ikeja, you understand? Let them tell you the total number compared to the population. The surgeons are you getting the logic now? We need just to be transparent to one another so that we can. These are not difficult. It's just that we are not ready. The government too are not ready. We too we are not ready. That's why we are not asking necessary questions. So we are just like, we know the problem and we are dodging the problem and we want solution. What we need is just transparency. Simple.
From affordability to the quality of care, citizens are calling for a healthcare system that actually works, the one that truly meets their needs. This is Citizens Direct on TVWest. I am Victoria Ogudende, and thank you for joining us.